High versus low blood pressure target in the patient with septic shock. What is septic shock in the characterized with arterial hypotension distinct adequate fluid restriction. The surviving sepsis campaign recommends targeting mean arterial pressure of the lungs 65 millimeters of mercury during initial resuscitation of parents with the septic shock. The guidelines of the Survive Sepsis Campaign 1. This Campaign 1 recommended initial resuscitation with the vasopressors to reverse hypotension with or the middle artery pressure target of the less 65 millimeters mercury.
Shock or hypoperfusion is the inability of the circulatory system to supply cells with oxygen. In early stages, symptoms occur as the body attempts to compensate for blood loss. Physiological causes of shock are the heart failing to pump, loss of blood volume, or blood vessels dilating, creating a vascular container capacity that is too great to be filled by available blood. Categories of severity are compensated shock, presents as an increased heart rate, increased respiration, and constriction of peripheral circulation, which results in pale, cool skin, and in infants and children, increased capillary refill time. Decompensated shock starts with low blood volume or lack of perfusion. Symptoms include falling blood pressure. Shock is irreversible when perfusion to the organs cannot be restored. Cell damage occurs, especially in the liver and kidneys. Even if vital signs are restored, irreparably damaged organs may cause death. The main types of shock are hypovolemic shock, caused by uncontrolled hemorrhage, internal, external, or both, or by plasma loss in burns or crush injuries. Cardiogenic shock occurs during a myocardial infarction or heart attack. Damaged heart muscle or electrical malfunctioning decrease the strength of the heart's contractions, causing a slow, fast, or irregular heartbeat. Neurogenic shock may result from the uncontrolled dilation of blood vessels due to nerve paralysis in spinal cord injuries. There is no blood loss, but the blood vessel dilation increases the capacity of the circulatory system, and available blood can no longer fill it. Sepsis, massive infection, or an anaphylactic or severe allergic reaction may also cause shock from blood vessel dilation. As an EMTB, you do not need to diagnose the type of shock. Instead, you must recognize and treat for shock whenever there is a mechanism of injury or signs that indicate the possibility of shock.
Septic shock is the major risk factor for the atrial fibrillation. And in our study, atrial fibrillation was significantly more common in the high target group than in the low target group. The adverse effects mean related to the significantly higher dose of the catecholamines of the long duration of the catecholamine infusion in the high target group. Conclusion. In conclusion, among the parents with the septic shock, 28-day and 18-day moderately differ significantly between those who were treated of reached target mean arterial pressure of 18 on 18.5 millimeters mercury, and those who were data the rate target of 16.5 of 17 millimeters mercury.
Doctor, the patient came in this morning with an altered level of consciousness, fever, and uncontrolled bowel movements. He does not speak English and his caretaker is in the waiting room.
Well, get the caretaker in here. Can we get a line established and hang a liter of fluid wide open?
The paramedic intern started a 18 gauge in the left forearm. The patient's vital signs are blood pressure 88/60, pulse 130, respirations 20, and a temperature of 104.5 degrees.
Go ahead and administer Tylenol Puerto Rico and get a full set of cultures. Once the first liter of fluid is in, go ahead and hang another 1000 cc's. I am going to place a central line in his left external jugular. Also, while we wait for the blood test to come back, we can start him on a broad-spectrum antibiotic. He appears to be septic.
Doctor, we are now a few hours into treatment and have administered 4 liters of normal saline. The blood pressure will not stay above 90 systolic. The patient's temperature has come down to 101.5 degrees and his pulse is now at 110. The ICU now has a bed open.
Okay,